Okay, let's focus now on aortic valve stenosis. Now, as always, a stenosis simply means a narrowing. Okay, so here we have aortic valve stenosis. Now remember, in aortic valve stenosis, the left ventricle would try to push blood headed into the aorta. So if you remember our picture from a couple of lectures ago, talked about how blood will have to go through a valve to get into the aorta. That is the aortic valve. Now, causes for aortic valve stenosis may be something like a congenital defect, meaning patient was born with some type of valve stenosis, some type of aortic valve problem. Another cause, and we've seen this in a couple of the other problems with valves, is rheumatic fever or rheumatic valve disease. Again, has to do with a patient that may have not been treated properly for a strep infection. Also, as we age, again, our body will go through some wear and tear, and as a result, the aortic valve may again become stenosed. It might not function like it should. So again, this will increase as we get older. So typically, patients that suffer from aortic valve stenosis are elderly patients. Now, aortic valve stenosis will result in decreased blood flow from the left ventricle to the aorta. So let's think this through. Again, there's going to be decreased cardiac output due to the narrowing of the aortic valve. So as a result, again, your body needs blood. That is how it gets its oxygen. So as a result of this stenosis, a result of this narrowing, the left ventricle will pump harder, because again, it must meet the demand. Now, as a result of the heart pumping harder, in this case the left ventricle pumping harder, again, the left ventricle, the heart is a muscle. The more you use it, the bigger it will get. As a result, the left ventricle will increase in size. Something known as left ventricular hypertrophy will occur. Now again, the heart can only sustain this for so long before the heart muscle begins to decrease in cardiac output. So what will result from this left ventricular hypertrophy is something like decreased cardiac output. Again, if you have a decreased cardiac output, you're going to have blood accumulation in the lungs. As a result, you have increased pulmonary hypertension. Now again, this being the result of decreased cardiac output, increased pulmonary hypertension, fluid accumulation in the lungs, it will be resulting in heart failure. So still, you're going to have the peripheral edema, jugular vein distension, the ascites, increase in abdominal girth. So this leads us into our clinical manifestations. We'll get the chest pain, again, due to the decreased cardiac output. Syncope, patient complaining of fainting. Why? Again, you have decreased cardiac output, you have decreased blood supply going to the brain. As a result, patient will pass out. Exertional dyspnea, again, due to the decreased cardiac output. Now, one thing that you must know for the Nclex exam is that, for example, a patient complains of chest pain, angina, or angina, depending on the pronunciation. you must know if they have some type of, again, aortic valve stenosis, because if the patient goes into the ER, starts complaining of bad chest pain, most likely, if you don't have a full history on the patient, you may begin to think, MI, possible MI. So in most instances, nitro may be given. Again, if they're thinking MI, they're going to try to cause vasodilation, open up those coronary arteries, so they'll give nitroglycerin. But in aortic valve stenosis, you already have decreased cardiac output, because again, the heart isn't pumping effectively. You have decreased cardiac output, you have decreased blood supply to the brain, to your muscles, and also to your heart. So that is what's causing the chest pain. It is, again, the decreased cardiac output. It is not vasoconstriction, it is not atherosclerosis, it is not a narrowing of the coronary arteries. So nitroglycerin will not do anything for this patient to relieve the chest pain. In fact, what it will cause is it will cause a severe decrease in blood pressure, because you're going to cause vasodilation. Now, this patient is already suffering from decreased cardiac output. You give them nitroglycerin, you're going to further cause a decrease in blood pressure, and you're only going to make the demand of that oxygen much higher. So you have to be very, very careful. You must know your patient history, because again, you give nitro thinking that it's an MI, you're going to cause severe decrease in blood pressure. So you're going to have altered mental status, confusion, because again, the brain isn't getting the blood supply that it needs. And in fact, you may cause even more chest pain, because again, you're not giving the heart the blood supply that it needs, because you're causing, again, a decrease in blood pressure.